Before I became a doctor, I was already a Christian. I think everything I am, everything I've grown into, has his hand in it. I can't wake up without talking to him. I can't. I can't start a surgery without talking to him. I can't sleep without talking to him. Alopecia is synonymous with hair loss. Many people who sometimes lose their hair even end up getting depressed, and depression takes away all of a person's strength. For us, it's already hard to be without hair. For women, it's something that's unthinkable. Either they use a wig or a scarf. For them, socially, it's very difficult. Transplantation is not a cure for baldness, it's simply a transfer of hair.
What can go wrong in a poorly done transplant here in Brazil?
Risks of infection, an unsuccessful transplant.
Can the patient die? You seem like a country music professional.
I've always liked country music. I'm from Goiás.
Amigo, a vida não tá fácil. É trabalho, é aço. É duro, é patrão. Trânsito, confusão.
My guest is no Samson. He comes from a family of bald men, but he has the invaluable power to make hair grow on people whose hair is no longer what it used to be. He comes from a family of doctors and decided to dedicate his professional life to solving the problem of baldness or near baldness. My guest is the president of the Brazilian Hair Society. And by using the most modern techniques we know of, he has been responsible for helping many Brazilians save time and money on plane tickets to Turkey, which until recently was considered the mecca of hair transplants. Oh, and my guest is also a country singer. Dr. Adriano Almeida, you may come in. Did you see the result?
How about that, huh?
It turned out good, right?
Great, huh?
I didn't think it would grow this much.
And red-haired?
Yeah, that happens. Hair color can change. It's normal.
That's not very common, you know? No.
But to grow like that, like Samson, to grow like that,
Yes. Now, being a redhead is a first for me.
you've never seen a result like this?
No.
All right.
Right? That's great. Perfect, huh?
And Samson? Is Samson a legend among trichologists?
Actually, many times when we start an introductory class in a trichology course, this figure can't go unmentioned, right? He's the patron saint of trichologists, right? So that's the thing. He's mentioned a lot, at least in my classes, because he's a figure that everyone knows, right? So because he appears in the Bible and most Brazilians are Christians, everyone has heard of Samson.
Is there really a strength that comes from hair? Maybe in a psychological sense?
Absolutely. Because you see, the lack of hair often takes away people's self-esteem. And self-esteem, the will to live, to feel good, to be beautiful, that changes a lot. That's why we see that many people who sometimes lose their hair even become depressed. And depression takes away all of a person's strength.
Have you ever seen transformations happen in your clinic?
Frequently.
Tell me.
So many times patients say, "Doctor, you gave me my life back. You gave me my self-esteem back. Today I'm a different person." My work has changed a lot because of this. Today I can go to a party, to a church. Many people stop attending, we mentioned church here. They stop going to church because they're ashamed of their baldness. And you can't go to church wearing a cap or a hat. So it's disrespectful theoretically. Of course, in my opinion, God accepts you in a cap, in a hat, however you come, and he wants you there at his feet, right? Like that too. So that's the story, right? I changed lives for sure.
I started by reading a passage from Judges, which is actually about Samson, but that story doesn't end well. Delilah was bribed by the Philistines, cut Samson's hair, and he was weakened.
But only sort of weakened, because he still had one last burst of strength to defeat the Philistines. He knocked down the pillars, asked God for this last strength, and received this last strength even with his haircut. So he managed to knock down the pillars of the temple and wiped out, I don't know, hundreds, thousands of Philistines who were there. So that's the thing. As much as hair can psychologically change people, I always advise everyone, you can't let that impact your life. So you should treat it, you should take care of it. Today there are treatments, and today there are hair transplants. But this can't lead a person to depression, to a lack of will to live. That shouldn't happen.
So from what you're saying about Samson, I can conclude that one of the greatest trichologists in Brazil is saying that hair is not such a serious problem.
Yes, it's at least a solvable problem. There's a solution. There's a solution.
And does it have anything to do with sexual potency? Oh.
What happens? There's even that story about how women like bald guys more.
Is that true?
What happens? People who go bald usually have higher testosterone. In other words, this excess testosterone is indeed linked to sexual potency. So the more body hair, for those with androgenetic alopecia, the bolder you are, the more virility you have, because you usually have more sex hormones, more testosterone.
The bolder you are, the more sexual potency you have?
More sexual.
Is that why you prescribe tadalafil too?
Tadalafil is often used after surgery to help improve things because tadalafil is a peripheral vasodilator. In other words, it improves blood supply to the periphery. Nowadays, tadalafil is used for many things. For example, COPD, people who have trouble breathing, whether it's because they smoked or for some other reason. They use tadalafil or sildenafil to improve the oxygenation of the lungs. And it also improves the oxygenation of the muscles. Nowadays, many people train with a small dose of tadalafil to improve blood supply to the muscle. And we prescribe it to improve blood supply to the follicle as soon as it is transplanted.
It's not to restore sexual potency.
It's not to restore sexual potency. In fact, most of the bald men who come to us are already bald because they have good testosterone levels, or even above average.
So now looking at my real hair here, which you did, I'm going to go back in time a little to remember how things started.
Things were different, huh?
It was complicated. Did it get really messy?
A bit, but it looks nice, right? It's been days since I last saw you. Pretty cool, right?
It looks full. I've already gotten over that problem of looking at myself in the mirror. Now I actually want to look. You know what's better?
That's what brings me the greatest joy. For sure.
My hair was really thin. It's always been very thin, and it was hard to comb. After the transplant, it got a little thicker.
For sure. Because you were already getting used to that hair that was thinning out. Today you have hair from the lower part that doesn't thin out. So the hair you had before you were 16 was this thick hair.
Oh, did I ever have hair like that?
You did it is the hair from the lower part of your head. So now you'll always have this thicker hair, which you'll be able to comb, style, and wear in a pompadour. Easy. Everything's easier, right?
Shall we go through the process? Yes. The patient arrives like this.
Or worse, or even worse than that. So the first step is this. It's a consultation, a trichoscopy. You remember I did a full examination with the microscope.
A little device to see how things are.
To see how things are? So through trichoscopy, we can identify the type of hair loss, the density of your hair, and if there is still hair that can possibly grow back. So all of this is identified through trichoscopy. After the trichoscopy, both of the recipient area and the donor area. The donor area is fundamental because without the donor area, there is no successful transplant.
You have to know if there is hair to take from.
It matters if there's a source to take it from. If there is somewhere to take it from, then we move on to the second step, which is what? Checking the patient's physical condition. So if the patient is in good cardiac condition because we do the transplant under sedation, the patient sleeps, he doesn't feel any pain. Since you brought up Turkey, in Turkey most transplants are performed by non-doctors. In other words, the person who performs the transplant, because it's not considered a surgery there, is a technician. So it's done while the patient is awake, without sedation. So there are many risks, definitely a lot of risk. Risks of infection. Since I've been doing transplants for 20 years, I've had many patients come from Turkey. Risk of failure.
Did the guy who came from Turkey say that?
The guy who came from Turkey, doctor, when I got here, my hair grew and now it fell out and won't grow back anymore. Or a patient with the entire donor area completely destroyed. So I've seen all of that already.
It's not that every doctor in Turkey is bad, but there are a lot.
No, I'm not saying that, but a large part of them are. So if someone decides to have a transplant in Turkey, first of all, make sure you find out who you'll be having surgery with there, because many times you'll be the one being operated on. There are doctors in Turkey for sure, but many of these transplants were supposedly cheaper because the transplants cost around $5,000 in Turkey. So people, when the dollar was cheap, used to go to Turkey because it made sense. Today, that's no longer the case. There's no reason anymore. Today, he pays the same $5,000 to a good doctor here.
Interestingly, I went to Turkey this year, in January, and I came back on a plane that was going to Paris, which was my layover, and it was full of French people coming back with their heads bandaged.
You can see that even the bandage is different.
Isn't that strange? Why were they bandaged?
Because they wrap the patient's whole head. There's a lot of bleeding. It hurts the donor area a lot. So, you remember when you left the operating room, you only had the bandage down here because all of this is done with blood pressure and heart rate monitored, and the anesthesiologist takes care of all of that.
I was really scared of the anesthesia. No blood came out. He tried 4 times.
That's it, right? Fear makes all the little veins disappear.
Was I just scared to death?
For sure. So, that's the story. Everything is monitored. The patient doesn't have a high heart rate or high blood pressure during the surgery, so there isn't much bleeding. We do all of this under the absolute control of the anesthesiologist. So, you don't need to worry because the surgery ends without pain, the patient doesn't leave bleeding, there's no blood dripping, nothing like that. That doesn't happen. It's different from many places. That's it.
Are you enjoying the interview with Dr. Adriano? You can see the connection he has with religion, how he talks about God, how he brings that into his work every day. It's really beautiful. Stay until the end. You're going to enjoy it a lot. By the way, did you notice anything about my hair compared to a few years ago? Thank you very much, Dr. Adriano. Did you know he's a singer? Stay until the end so you can follow along. You mentioned Turkey, but here in Brazil, I've already seen transplants ranging from 8,000 reais to 80,000 reais, right? There are all kinds of prices. Can you trust a transplant that costs 8,000 reais?
No, you can't. And you can't think that you're going to have a transplant for 8,000 reais and get proper sedation, an anesthesiologist just for you, a quality medical and technical team accompanying you, and decent post-operative care. It doesn't make sense. If you do the math, it doesn't make sense.
What's going wrong?
What's going wrong is that patients aren't being operated on by doctors here in Brazil, just like in Turkey.
Also,
who changes it in this case? Nurses, technicians, like there are already many clinics here that are being investigated and even shut down for illegal practice of medicine.
jail time.
That in Brazil, you know that getting jail time is difficult, but these clinics are already being investigated and many are being shut down, and the patient has an easy way to help him decide. Reclame Aqui. So, many of these doctors and clinics are already on Reclame Aqui. So, it's easy, it's important to look for that. Some guidance, a recommendation.
What are the signs that a clinic is not trustworthy for a transplant?
First, very cheap. Second, a lot of pressure for you to book that transplant. No, book it today, book it today, book it today. So, the patient has to have complete freedom to choose the doctor they want to go to. So they should look for recommendations, ask about this doctor, check the internet, see who the doctor is that's going to operate. Many patients buy a transplant without knowing which doctor will operate.
What can go wrong with a poorly done transplant here in Brazil?
In a transplant, a poorly done transplant with an ugly hairline,
A transplant ends up looking like those helmets, right?
a helmet, that straight line. In fact, there are even public figures out there who had a transplant and it turned out really badly.
I'm not going to mention any names.
I'm not mentioning any names, right? So the risk of infections, that risk is imminent. It's a surgery with thousands of tiny holes. There's no incision, but there are thousands of tiny holes.
Can the patient die?
Yes, as there have already been several deaths from hair transplants in Brazil, including recent ones.
What happened?
Even Band, where you were last, came to my office to interview me about this, right? An anesthesiologist, right? I'm saying this because the story was public. I won't mention any names, but he went to perform a hair transplant, right? The anesthesiologist went to perform a hair transplant. And during this hair transplant, the patient had a cardiac arrest inside a building. And there was no way to assist this patient. This patient died.
Wasn't it a proper surgical room?
It wasn't a proper surgical room. And besides this case, if the viewer wants, they can look for other cases of death from hair transplant. Unfortunately, that's a very bad thing for us to have to say, but it's a fact. So, the patient has to be careful to look for a good professional to perform their surgery. And do you remember that when you had your appointment, the second step was what? To do tests. So you did heart tests, blood tests. So why is all of this so important? To ensure the procedure is safe for both the surgeon and the anesthesiologist. And the surgical environment, you arrived at the clinic, you observed. In my surgical center, there is a ventilator, a power generator, everything just like a hospital. This is fundamental.
If there's a breakdown, it solves it.
If there's a power outage, it takes care of it. There's no ICU. But we have all the equipment needed to transfer the patient if necessary. So that's very important. A qualified team, an anesthesiologist monitoring the surgery the whole time so that everything goes well.
After analyzing, we reach this stage. What is this? It looks like a tattoo. It is.
These are the markings. So the markings will guide me. Hairline, how far I want the hairline to go. Hair angle, because many times the patient goes to the doctor to get it done, or even to Turkey like you mentioned. He comes back with hair, but all the hair is like this. So he can't comb it, can't fix it because the hair is like this.
Does each hair have a direction?
It has a direction. How do you do it? You can see in this photo, for example, your crown has the little lines, your front has the little lines. All of that is the direction of the hair. When it changes, I draw the direction of the hair before shaving. And I already mark out the donor area and the recipient area. Why? If I go too high with the donor area, if I get too close to the crown, what happens? I might run the risk of transferring weak hair that may fall out. So what about the hair?
By that, I mean weak hair that will fall out.
Weak that will fall out. Because we have two embryological areas in the head. The top of the head, which is where the hair weakens, comes from the neural crest, and the lower part comes from the mesoderm. So I have to take hair from the mesoderm-derived area, which is hair that doesn't weaken, and move it to the top part.
Explain it. What is the neural crest?
When we're at the embryological stage, in the mother's womb, the way our head forms is different. The scalp skin doesn't form simultaneously. So part of it has an embryological origin, which is the mesoderm, which is the lower part, and the upper part, later, originates from the neural crest.
So there are hairs that are deeper and others that are less deep.
That's right. The hair on the upper part falls out because it's affected by testosterone, and the hair on the lower part isn't. That's why the principle of hair transplantation is to take hair from the lower part and place it on the upper part. If I took it, for example, from the crown and put it in the front, it would fall out just the same.
So really it's explained that it's the bald guys they like the most.
They like them more, you're right. When it comes to virility, yes.
You said we can take hair from a lot of places. Mine was taken from back here, right? It was mostly this area, I think, and a bit here and on the sides too. The sides were thin at first, but then it started growing.
Yeah, growing.
What are the other possible places?
We can take hair from the beard, from the chest, but you don't really like that. No, I don't do that. I rarely do a body hair transplant. Why? That hair doesn't grow the same. It has a different thickness, so it doesn't look natural.
Is there any special type of hair hidden somewhere on the body? For example, is hair around the anus good?
No, it's not either, because it's too thin. Body hair is very thin.
Pubic hair?
They're very thick, right?
Armpit?
No, this hair is usually used, for when the patient doesn't have a donor area. Then yes, we remove it.
A friend of mine who went to get a transplant is very upset actually because they removed his entire beard. He didn't even like the result, but he's already going bald again. What happened? What could have happened?
Because this body hair is prone to falling out. Studies show it doesn't last as long as scalp hair. He might not have liked this result because it doesn't look so natural. Actually, Rodrigo, body hair, which is now a transplant trend, has already been used in the past, taking hair from the body and transplanting it to the scalp. I've done transplants for 20 years and conducted all kinds of studies, including taking it from the body. I tested that, but it doesn't look good aesthetically. This comes and goes, comes and goes. So nowadays, many times the doctor tells the patient, we're going to take hair from your body so we can transplant more. But doing a transplant just to make the hair look unnatural, I think that's nonsense. It's better to have thinner, more natural hair.
So what happens if your patient has very little hair?
Sometimes I advise against it. I say, look, it's better for you to look for a hair system, look for another solution, because the transplant, a hair system? A hair system.
I thought wigs were extinct.
No, for those who don't have a donor area, no.
So I'll keep it here.
Keep yours, but you won't go bald since I did it. Or there's that option, just do one area, for example, just do the front, the visible part, and leave the crown. That's a possibility for those who have a small donor area.
If a patient says, take it from the beard, won't you? I will.
Hair system. If he insists on taking it from the beard, I'll do it.
Warning.
Warning about all of this. It's a transplant that can't be permanent. You'll have to keep your hair short, shaved, so it doesn't have an unnatural effect.
After this stage of the indigenous tattoo, the tribal one we do on the head, we move on to this next phase.
So for me, it looks beautiful there, right?
It looks like a planet.
That's it. All the follicular units have already been inserted into their openings. So first we do it like this.
I do it. You specialize in placing grafts into the openings.
Yes, for sure.
That's your specialty.
It's a specialty. So I make all the pre-made incisions because you can place the hair directly. However, the instrument that places the hair is cylindrical, round.
It's like a needle.
A needle, as if it were a needle. And it leaves the hole depressed. So, if I look at your hair, there's nothing. The little holes where your hair grows aren't sunken. It's straight. When you implant directly with the implanter, because it's cylindrical, it removes tissue, it makes a small cut, and it stays depressed. So when you look at the patient, you notice it?
So, is doing it directly with the implanter a mistake?
In my opinion, yes.
And a lot of people do it.
A lot of people do it because it saves time.
I should ask, well, not me, I've already done it, but someone who's going to get a hair transplant should ask the doctor, are you going to use the implanter directly? Is that the question?
That's right, that's it. Or are you going to make the incisions beforehand? It's because it saves time. For example, it takes me about an hour and a half to make the incisions beforehand, so the surgery ends up being longer.
Mine lasted 12 hours.
If I'm not mistaken, about that.
What's the longest you've ever spent in an operating room?
I've spent maybe about 15 hours.
Have you ever done it 2 days straight?
I don't do it 2 days in a row. No. Why? There are doctors who do it 2 days in a row to perform 2 surgeries. I don't do that. I do 1 patient per day because sometimes the doctor doesn't sedate the patient and the patient gets tired. So he does 1 patient, half of a head, then the patient comes back the next day to have the other half done.
I consulted the doctor before doing it with you, and he suggested doing it in 2 days.
That's it. Now, please.
Why does Dr. Adriano say he'll do everything in 1 day?
This guy gets it done in just 1 day. Why? You don't move, you don't feel pain, you don't bother me. I can stay focused on you because you're anesthetized. And then on the other hand, the surgery also takes longer. Yeah, so that's the story.
But 12 hours is a bit exhausting.
Exhausting.
How do you prepare yourself to spend 12 hours doing something that's very meticulous?
Oh, usually I space out my surgery days.
You don't do them back to back.
I don't. Sometimes I do. Sometimes there's one on Monday, Tuesday, and it eventually happens. It's not ideal, but these aren't ideal situations, right? So usually I alternate. I'm someone who lives a very measured life. So like I don't smoke, I drink very little, I exercise. So I do all that. My life is planned down to the minute. Even for us to be here, you notice that my life is planned down to the minute. So I'm a very focused person. My life is work and family.
You're only in the office Wednesday to Friday.
From Wednesday to Thursday until Thursday. Monday, Tuesday, Wednesday, sometimes Thursday. Oh, okay. I don't work at the office on Friday. So I always, on my weekends, I rest.
No, wait, you'll tell me about that weekend in the second act. I bet you have great stories.
So I always try to clear my mind to have a peaceful life, right? So you can stay focused on what you're doing.
Your head used to get a lot more air before.
Yes, it was, right?
It was. How was it? Did you realize early on that you would go bald?
Look, I come from a family of bald men. My father is completely bald. So at 16 years old, I started losing hair. And my father, since he's a doctor in a small town, always gets visits from all the sales reps. So as soon as finasteride came to Brazil, my father got a visit. Hey, there's a medicine here for baldness. Since I was losing hair, he said, there's a medicine for hair loss. So I started finasteride at 16. I've been taking finasteride for 31 years.
And are you still taking it?
I'm still taking it. I always remind all of you who get a transplant that the transplant is not a cure for baldness. The transplant is simply a transfer of hair. That's why in your post-operative period, what did you have? Treatments. So I gave you medications to use at home.
This was the phase right here. Look at that. I don't like remembering it.
The scabs were still there, huh?
It lasted about 15
days. Yeah, that's right, about 15 days. Then after 15 days, you go to the office. My team removes all the scabs if there are any left, and then the hair starts to grow.
I even went to a show, to a theater the next day, but I went with a scarf on my head because I couldn't.
Those scabs...
I couldn't. So after the transplant, you have to keep going. You have to...
Forever, taking care of it forever.
What are those precautions?
Usually, a good shampoo to avoid oiliness, because too much oiliness is not healthy for the hair. Some antiandrogen, which in this case is finasteride or dutasteride. And for those who don't take synthetic medications, sometimes saw palmetto, pumpkin seed oil, and others. So, women also undergo hair transplants. So there are other medications that we prescribe for them. Yeah, I saw it.
I don't remember seeing a woman who was 100% bald. Are there any?
There are not only androgenetic alopecia, but there is a disease called frontal fibrosing alopecia, or frontal fibrosing alopecia, which takes away all the front part of a woman's hair and even the vertex. She becomes bald up to the vertex. Many times, these women who have the opportunity for an early diagnosis, we make the diagnosis, treat them beforehand, and stabilize the condition. And we perform transplants on these women with good success and good results. Because for us, it's already hard to be without hair. For women, it's something that's impractical. Either they will use a wig, a scarf. For them, socially, it's very difficult to be without.
Not to say that it's the bald ones they like the most.
You can't say that. You just can't.
But you were explaining about the treatment. It continues. There's finasteride. There's minoxidil.
minoxidil, vitamins, both at the same time because one is for one thing and the other is for something else. While finasteride prevents hair atrophy, what does minoxidil do? It prolongs the hair's growth phase. So today it already exists. We also compound oral minoxidil. Actually, minoxidil is very old. Why is it effective? So that's the story of minoxidil, both topical and oral. It's very effective.
But it's not just those two. I take 4 or 5.
And you take vitamins. Vitamins stimulate development, and you remember that you had your vitamin levels checked before taking them. You take the ones meant for you. For example, your vitamin is different from mine. Each patient takes a personalized vitamin supplement.
What are the procedures or actually the habits that someone can have from an early age to avoid baldness or to delay, postpone baldness?
A proper diet.
What is that?
There are some nutrients that are very important for hair. Copper, zinc, iron, vitamin B12, vitamin D. So for example, vegetarians experience a lot of hair loss. So protein, meat is important. Oh, does it need to be in excess? No, it doesn't need to be in excess.
A vegetarian says that they find protein in seeds and in other ways.
But their ferritin is usually very low. The iron reserve is very low.
He needs to take iron.
He often needs to supplement iron.
There was nothing funny about that.
That's why I said to supplement.
So eating well means eating meat. It's good for your hair.
Meat, vegetables, fruits. What isn't necessary? Sugar and carbohydrates. That won't help your hair at all. Not at all. No, that's food your hair doesn't need.
A young person who's just starting out like you at 16 years old realizes that their hair won't last long. What food should they focus on?
Meat. If he can choose one, meat.
There's vitamin D as well.
Vitamin D, B12. So in meat, he'll also find B12. In seafood, in fish, A and D.
Do you mean just beef or something else? No, beef is the important one.
The important one is beef.
Chicken doesn't count.
Chicken has less iron. Pork has more. So first beef, then pork, then chicken.
That coming from a cattle farmer's son is a bit biased.
No, but now it's not biased. It's necessary.
What else besides food?
And an early diagnosis. Because sometimes when it comes to genetics, there's no way to avoid it because you've already inherited that gene.
That was my question, which might have been number 1. Back when I was 15, my grandfather on my mother's side was bald. And I heard people say bald grandfather, bald grandson. Is that right?
No, it can be, but it can also skip generations, for example. My grandfather wasn't bald, nor was my grandmother. And my father is...
And you would be if not for the transplant.
Without treatment and a transplant, you might be in much worse shape. So that's the story, right? It's not necessarily that if the grandfather is bald, the grandson will be bald, right? But it's a myth. It's a myth, but it can happen, right?
What are the other recommendations?
Besides this diet and early treatment, we say it's important to take care of the hair's oiliness, right? Because men, due to testosterone, produce excess oil. So the body often keeps releasing that protective oil layer can build up too much on the scalp. This also promotes hair loss. So using a shampoo that removes this excess oiliness, that cleans the scalp better, is very important.
Does a person who has dandruff have a greater tendency to go bald?
A person who has dandruff usually has more oiliness. And then, yes, when we compare one thing to the other, it definitely contributes, right? Excess oiliness contributes to both dandruff and hair loss.
I remember very early on, in my teenage years, I would grab the towel and rub it on my hair really hard. It was even pleasurable because it was almost like a massage. Am I speeding up my baldness by doing this?
You're not bringing it on sooner, but you are making it shed faster. Why? Our hair has phases. An anagen phase, a catagen phase, and a telogen phase. Why didn't I keep growing? Why did I shrink? Because the hair is in the anagen phase. That's when it grows. And then it starts to evolve. You are stimulating this premature hair loss by rubbing your hair.
So is rubbing the towel too hard on your head bad?
It's bad. It's bad, for sure. You're making your hair fall out faster. A hair that would have stayed on your head for another 2 or 3 months, you're pulling it out. In the same way, when you tie your hair up, for those who wear a ponytail, whether you're a man or a woman, if you tie it tightly, you're encouraging your hair to be pulled out. I even have an example. He's a well-known person, a soccer player. He, on one occasion, Aruka, came to my office. He used to wear dreadlocks. And I said, Aruka, either you take off the dreadlocks or you're going to go bald. You're causing your hair to be pulled out.
Exactly. The guys who grow their hair long are actually encouraging baldness.
Because all those dreads hanging down, those were creating tension on his hair. Then he switched to some tiny little dreads and it got much better.
So if Bob Marley had lived longer,
He would have gone bald, maybe bald. And it's a scarring alopecia because it permanently removes the hair. What?
what is alopecia?
Alopecia is another word for hair loss. Within alopecias, we have scarring and non-scarring types. Some can be misleading. For instance, with scarring alopecias, hair won't regrow. Lupus, lichen, Brock's pseudopelade, frontal fibrosing alopecia, which I mentioned happens in women. When these hairs are gone, they will never come back.
These names are scary. What are they again?
Lupus, lichen, Brock's pseudopelade, frontal fibrosing alopecia. So these are scarring types of hair loss. Non-scarring androgenetic alopecia, because even though the hair falls out and doesn't grow back, there's still a little fuzz left. So if you look at a bald person's head, they have some tiny hairs, but they don't grow, they don't develop. So it's not scarring. Alopecia areata, which people confuse with scarring because it creates a bald spot. Many people, even celebrities, have had visible alopecia areata. For example, Danilo Gentili.
You were the one who did his hair.
Yes, I took care of his hair for a long time. He lost part of his beard. He lost a patch of hair. So, my friend, he says he sees people on the street and gives them my card. I say, look, call him, go see him. This is alopecia areata. Go see Dr. Adriano. He took care of me. Duda Nagli, who is Sabrina Sato's ex-husband, had it in his beard and others too. So it's an autoimmune disease, but it has a very unique, intimate relationship with stress. This disease, when we tell a patient to start treatment for alopecia areata, we always say, look, you need psychological support.
When you went on Dario Gentili, which I saw, was that in 2018 or 2019? Yes.
That's right, because it was right after Lorenzo was born, and I even went there one of those times. Lorenzo, your son, my son.
Didn't you used to have less hair?
No, because I hadn't had a transplant.
Oh, you hadn't, right?
No, I hadn't had a transplant.
But I wasn't bald yet.
No, I was never bald because I've treated myself my whole life. What happened is that my forehead grew a little, that's it. So in 2020, time went by. In 2022, that is 4 years later, I had a transplant.
So in that interview, had you already performed Danilo's transplant? No.
I took care of it. Danilo didn't have the surgery. Oh, he didn't have the surgery.
He treated it. He had something in his beard that he shows, right?
So he had alopecia areata, but that grows back. So I treated it and everything grew back.
Oh, his problem was just here?
And on his head too.
Wasn't it a transplant?
It wasn't a transplant, just treatment.
That big head of hair of his is real.
Yes, and then by treating and taking care of it, it grows.
Is it real too?
Yours is too. It's all yours. It doesn't belong to anyone else. It's all yours.
When does someone come to your office and you say you don't need a transplant?
Oh, many times I advise against a transplant. Sometimes the person, just yesterday there was a young man who scheduled an appointment to get a transplant. And he said, oh, my hair is thinning. I said, look, I think you should. Then I ask, have you already tried treatment? No, I haven't had any treatment. Or, I had treatment and I see that it was inadequate. I ask him, let's give the treatment a chance. Because I think you shouldn't skip steps. Because when you skip a step, which is the treatment, sometimes the person wants to have a transplant just to avoid treatment. And that's a mistake. So they should first get treatment, see if the treatment is effective and meet the expectations. And then we move on to the second stage, which is surgery.
And many times the person won't need it.
They won't need it. So I'm very transparent. I'm very honest. I say, look, give the treatment a chance. It's important to try treating it. Even with surgery, you'll still need ongoing treatment. And then I ask, look, give me about 6 months so we can try.
You tell him not to get the transplant.
Sometimes I ask him not to do it. Because, Rodrigo, the best thing is to be transparent and honest with people. Why would I operate on a young person? It's a risk. It's surgery. If I can avoid it.
Young people usually don't need it.
No, there are young people who already come in very bald who need it. But many don't, right? And sometimes there are some older people, because sometimes you see a friend who's had surgery and looks really good. Then you say, I'll go have surgery too. And then during the consultation, in the conversation, you say, look, have you already treated it or not? Oh, let's try to treat it then. What is it that bothers you? Oh, it only bothers me because it's a little thin. And the receding hairline? Oh no, not the hairline. I'm 50, so it doesn't bother me. Let's treat it. And sometimes it helps avoid surgery. Then if you want your hairline back, there's no other option. You'll have to consider surgery.
There are some sciences, some medical specialties that we see evolving very quickly, as is the case with hair transplantation. This didn't exist in this way 20 or 30 years ago, I believe.
20 years ago, I've been doing surgery for 20 years. 20 years ago, we used a technique called FUT, where we would remove a strip of skin.
Did you need stitches? Did you remove the skin?
We would pull out the skin. There were surgical stitches, and then we would separate the hairs one by one. I wasn't part of the old doll hair generation because we were already separating the follicular units.
What is doll hair?
In the past, there was a transplant that transferred clumps of hair. So, when you looked at the patient, there were these little clumps. So ugly. Ugly, it wasn't aesthetic at all. They used to call that kind of hair doll hair. So, I'm not from that generation. For the past 20 years since I started doing hair transplants, this procedure is no longer done that way. But it used to be done by cutting the skin. And then there were surgical stitches, and we would transfer the hair after separating them under the microscope, follicular unit by follicular unit. Today we extract the follicular unit itself, we make a small hole and remove the entire follicular unit.
And why did you know how to do this 20 years ago?
There weren't any instruments for that. There weren't any micropunches. Because when we're going to make a little hole, there's an instrument we use to cut around the hair. There were already macropunches, but they would remove several, yes, blocks of hair, so it looked unaesthetic.
What is the material of this tool?
Surgical steel, and the size I use 0.8 millimeters.
Like a mechanical pencil, 0.8.
Like a mechanical pencil, 0.8. It's really thin.
There's no diamond at the tip.
No. The sapphire, since it looks like a diamond, is what I use to make the little hole.
So how does the process work?
I take it out first, then it goes to a table.
For example,
I removed a tiny strand of hair, one of your follicular units.
then I separated it on the table.
It's going to be separated on a table. Then on the table, they'll separate what's a single hair, what's two, and what's three. Because when I put it back, for example, you can see yourself. All of them are single. There's no block of hair up front.
And if the anesthesiologist blows, everything gets mixed up.
That's because it's inside saline solution. If he blows, nothing will happen. And then all of this will be separated, so it can go back to you later. Then the ones with one hair, two hairs, or three hairs go back in, also in a gradient.
Like type 1, 2, 3, where is it going?
Which way? Which way? That's the angle the hair will be directed. That's why I do it. That's why you can't delegate the transplant. It can't just be a technician who does it, because the final result will depend on that.
What knowledge does a doctor who specializes in trichology have that other doctors don't? What's the real science behind it?
Well, first, you have to have, I always say, when I start the first class, you have to be a very patient person.
I would never have the patience to do what you do.
That's it. Because for me, a day of surgery is like therapy. It feels like I'm really involved in that for me. It feels like that's a relief for my mind.
It's easy when it's not your problem, right?
So that's a relief for me. It's a pleasure. So you're going to do it with care, with dedication. And every little strand that you see growing in at the right angle, neat the way I'm picturing your hair now with a quiff. So, that's the greatest joy of my life. I dedicate myself to this with all my love, with all my passion.
Do you have to be a bit of an artist?
Absolutely, absolutely.
Not just because you drew here.
You draw everything by hand because I can already start to see your hair. It's about designing the hair to suit the face, right? To see your hair before it even exists. So, sometimes you go to the doctor, sometimes you see on the internet the doctor with a little laser, everyone with the same forehead. That doesn't exist.
So designing hair to suit the face isn't just a trendy phrase to sell haircuts.
No, your hair has to look good and be in harmony with your face. All of that is important.
What were you thinking for me here?
In your case, for example, do you remember that I said don't get Botox right before the surgery? Why? I need to see how your hair was in the past. Your own anatomy will tell you that.
What Botox are you talking about? I didn't get any.
No, I asked the patient not to get Botox right before the surgery. Why? The patient's facial expressions are very important to me. If the patient comes in with their head completely shaved, it messes things up a lot.
There's no way to know.
Why? I want to see the angle of the patient's remaining hair so it looks as natural as possible.
I had a little cowlick here. How did you solve that?
I did the same.
Oh, you kept it? You kept it? I had the same, but it's not there anymore. I don't feel it anymore.
It's thicker now. Because now you have thicker hair. So that's the key point.
It looks good. I also wanted to know, because I ended up interrupting you, what else should we avoid so we don't lose hair? I mentioned the towel. What else? Look.
It's the hair dryer, right? It's not good. We should respect the limits, right? So both the heat from the hair dryer and the flat iron, they break the hair, they damage the hair. So if you're going to dry your hair, always keep it about 20 centimeters away from your hair. Chemical procedures.
Do hairdressers know this? Yes, they do. Do they keep that distance?
At least those who are guided by me, those who watch my podcasts and follow my guidance know this. Because hair is a protein, Rodrigo.
Give us the details. Where can people watch your podcast?
You can watch it on my Instagram. Every Tuesday, sorry, today is Thursday. I have Thursday on my mind. Every Tuesday, every 2 weeks, I do a taking care of your hair session. It's on my Instagram. So every 2 weeks at 9 p.m., people can join in. They can ask questions live. So it's always a pleasure. I dedicate half an hour to chat and answer questions from everyone who joins. Patients join. Patients from the United States join in, joke around, chat, and share their stories, their success stories. Oh, I didn't have hair. Dr. Adriano helped me, doctor, so it's really cool. It's a moment of interaction that I have every 15 days on Tuesdays at 9 p.m.
There you also teach what not to do.
You also teach what not to do.
Rubbing with a towel too hard or using the hairdryer too close to the head is bad.
You have to be careful with hair straightening, especially women. So, don't stack treatments. For example, if you color your hair, wait a few days, moisturize before doing a straightening treatment. Because many times she wants to get ready for a party. She wants to dye, straighten, and blow dry her hair to look beautiful all in one day. That doesn't work. That's too much damage for just one day. So you should plan ahead, right? I'm going to straighten my hair. All right, straighten your hair, do a few hydration treatments, dye it the day before, because when you dye it, you want it to look good. You don't want to have white roots showing, right, ladies? So leave the dyeing for last, hydrate your hair. These precautions are important. Hair is a protein. If you heat that protein too much, you denature that protein.
Is it purely protein?
Pure protein and water. So, here's an example I always mention. If you have a raw steak and you put it on a grill, you'll never have a raw steak again. So, if you take your hair and heat it too much, right? You can even compare not only the hair dryer to a flat iron. You'll never have your hair the same again.
Never again, really? Never again.
You're burning it. If you damaged it, never again, really. Of course, I dried it with the hair dryer. I quickly used the flat iron. I didn't reach a temperature to fry or cook the hair. No, it's going to stay normal, right? Because when you heat the hair, you break the bonds. We call them hydrogen bonds. So the hair gets straight, but after you wet it, it goes back to its original shape.
But it comes back with the problem. No, in this case...
No. If you just dried it properly, broke the hydrogen bonds, it comes back after you wash it, it goes back to being, for example, curly. If you break the disulfide bonds in the hair, which is done through straightening, then it changes the shape of the hair. So after you change its shape, it doesn't go back to its original form anymore.
And if you do what?
About straightening, no.
But what's wrong with this straightening, no?
It's not wrong. When you want to straighten, you do this, you break the disulfide bonds. So they're broken, that's fine. Then you moisturize, take care of it. So it's not wrong. That's what straightening does. But the hair becomes more susceptible, so you have to take care of it, moisturize it, so it doesn't break. That's what we call chemical breakage. Have you ever heard of that? No. That's what chemical breakage is. When straightening started in Brazil, I've been doing this for many years, right? Do you straighten hair? No. I mean, I've been taking care of hair for many years, right? So I saw this happen in Brazil. Rodrigo, people would come to the office bald. Why?
That's Japanese hair straightening, right?
That too, right? There's Japanese, strawberry, banana, chocolate. It's all straightening. So, Rodrigo, people had no sense. Anvisa didn't have any control over that. And there were still the hairdressers playing chemist who mixed formaldehyde with this and that. Sometimes it would break off all of the person's hair.
On the inside?
Everything. It would melt the hair, Rodrigo. They had to shave it with clippers. Can you imagine a woman? Beautiful hair. She went to straighten it. Suddenly the hair turned into rubber. And she had to shave her head. This happened several times in the office. The person would arrive without hair. Sometimes we thought, is it chemotherapy? Did they come here to stimulate hair growth? When they arrive, you already wonder, what could it be? You already start wondering what the person's complaint will be. Then the person would start, I had my hair straightened. She'd remove the scarf, no hair. So, at the beginning of hair straightening in Brazil, that's how it was. And then, of course, Anvisa regulated it, removed formaldehyde from straightening products, which was a big step. Because it was harming the clients and even more so, the hair professionals. Because they were inhaling that formaldehyde 5-10 times a day.
What are the risky procedures today?
This is one of them.
Does it still exist?
It still exists. And there are still some people who insist on using formaldehyde. So that doesn't make sense anymore. The good salons, many salons, in the beginning even put up signs at the door. No formaldehyde allowed here. We don't use formaldehyde, as a point of pride that it had been abolished. So this is very dangerous.
I love taking hot showers, really hot. I'm damaging my hair.
You're damaging your hair. Because you're stimulating the sebaceous gland. You dilate the sebaceous gland. It makes your hair oilier.
This will lead to baldness.
This can contribute to dermatitis and it can contribute to baldness.
What else can't I do?
Let's see. What else, huh? Now you caught me off guard. Cap? The cap. For many people, a cap is useful, Rodrigo, especially for those who are balder. Why? It protects against skin cancer. And yes, it does contribute a bit to seborrheic dermatitis, but the cap does not cause baldness. So people say, oh, I wore a cap a lot. That's why I went bald. No. That can't be attributed to the cap. The story, here come the legends too, right? Cutting your hair according to the phases of the moon. So the full moon is for volume, the waxing moon is for growth, and the waning moon, not a chance. So, like, this has no scientific basis. None at all. The moon does affect the tides and other things we observe, but when it comes to hair, there's no connection at all.
You can cut your hair under any moon.
You can cut your hair under any moon. Support hairdressers. They need work during every moon phase.
You mentioned chemotherapy. Are there treatments that help hair regrow after chemotherapy?
Yes, there is, after they're cleared, depending on the case. What we generally avoid, especially in women with breast or gynecological cancer, is medications that affect hormones. But vitamins and stimulants can indeed be used to help promote hair growth. And what happens is that after chemotherapy, Rodrigo, the hair can grow back differently. So many times the hair grows back a little thicker or a little thinner. We even have an example that everyone followed, and at the time, many people asked me about it. It was Giannichini, who had straight hair, and after his chemotherapy his hair became wavy. This can happen, but the hair tends to return to its previous shape, in his case to being straight. It's a matter of time.
And it tends to grow again.
It tends to grow normally.
And is a transplant from another person possible? Will it be possible one day?
It would already be possible. However, the recipient of this hair would have to use all the medications that an organ transplant patient uses. For example, someone who gets a heart transplant or a kidney transplant, and these are very strong medications, Rodrigo. They include immunobiologics and corticosteroids. So, for an aesthetic purpose, it doesn't make sense for someone to become dependent on so many medications afterwards.
Combiante audio sirvuna, my friend. The future of hair transplants or the future of hair?
So, what we hope for the most one day is that there will be tissue replication. In other words, that I could, for example, take 1,000 follicular units from you and be able to replicate that, to clone that. The tissue, since I doubt I'll see it in my lifetime at my age, though we often end up proven wrong, right? I never thought that we'd be living with everything from the Jetsons today, right? Except for that teleportation, right? Everything else we already have, right? But we would be able to turn a cell into hair. But if we could transform the tissue, replicate the tissue, hair by hair, for me, I think that would already be a major step forward.
It seems possible. Is there research on that?
There is research, but there isn't a definite possibility yet, right? There's research, but there isn't a way to replicate it yet.
And does artificial intelligence have any application in hair treatment? No.
Today, I don't really see artificial intelligence helping that much, but it will be the future, right? It could be that it will make its way into medicine too. I'm not going to rule that out because it's very present, really present.
Can you see a way where artificial intelligence could be useful?
Oh yes, for example, in genetic coding and such. It's interesting. I think it could do that because you see you can search, for example, studies from all over the world and put them all in one place. So that speeds things up a lot. So that's the story of artificial intelligence. It can perform something that's already being done here in India, in the United States, and you take all of that and put it together in one place. So all the experience from India, from here in the United States in one place. So this makes things happen much faster and helps a lot.
We're here in Sao Paulo, but we can hear your accent. Your accent isn't from Sao Paulo. Is this where it all started?
That's where it all started.
Where are we right now?
We are in Ipora. That was a hospital founded by my father and other partners. My father is from Goiás. My father graduated in Manaus, where he met my mother, and after finishing medical school, he returned to Goiás. So when he returned to Goiás, he built a hospital in Ipora.
A general hospital.
A general hospital, a hospital with 100 beds. So
Does it still exist?
that still exists. Goiás and Ipora in particular, it's the Cristo Redentor Hospital. It was a medical hub because Mato Grosso was very underdeveloped. So all the medical cases from Mato Grosso, surgeries and everything would come to Goiás. And the first more developed city, a medical hub in Goiás, was Ipora. Sometimes I'd go out with him and ask, Dad, where to?
Is it Ipora?
Ipora. Up north? No, Ipora is in the Midwest. From Goiás.
From the Midwest of the Midwest.
West, yes. You've probably been to Trindade. Trindade?
Yes.
Yes. So, on that same highway, after Trindade comes São Luís dos Montes Belos, and the next one is Ipora. Ipora.
And that's where your father's hospital is.
And the hospital, which is no longer my father's, since my father has already retired, now he does other things, and the hospital is still there to this day. So it was a medical center.
And why didn't you go work at your father's hospital?
My father always encouraged me to stay in a big city, so when I graduated, he still had a hospital. And then came the question, son, don't you want to come and...
Did you already know your desired specialty?
Yes, I was already doing dermatology, so after I finished, he even asked me about it. Don't you want to come to the hospital? Are you interested in taking over the hospital, running the hospital? And I had already found my path here in Sao Paulo. And even following his advice, his encouragement, I said, no, Dad, I'm going to stay in a bigger center.
And then where did you go to college?
I graduated in Rio de Janeiro, came to Sao Paulo to specialize, did my postgraduate studies here, and got my master's degree at Unicamp. So my life was built here in Sao Paulo. I met my wife right after I arrived here in Sao Paulo, and now there's Roberta and Lorenzo.
Is he your only child?
He's our only child. So I met Roberta.
Is that why he's like this today?
He's older now. How old is he? He's missing teeth, right? Yes, he's 7 and missing teeth.
So did you meet your wife here?
Here in Sao Paulo?
So you didn't want to go back anymore?
No, actually, Roberta has always been a great partner. If I decided to go back to Goiás, and she loves Goiás, she likes Piqui even more than I do. I like Piqui, but Roberta loves it. I love Piqui. Really? I love it. So I like Piqui, but Roberta, wow. Where's Roberta from? Roberta is from Limeira.
Land of coffee, that's right.
Which turned to oranges, right?
There's a lot of sausage there today, it's famous. Oh, really?
Yeah.
I was there. It was the famous Limeira sausage.
So it turned to oranges, and today Limeira is a hub for automobiles, manufacturing auto parts, and other really big things. It's also the capital of costume jewelry, right? So Limeira became a really big city.
And was your childhood like that?
My childhood was like that, divided between the hospital, because I lived near the hospital, so I spent a lot of time in Ipora, right? At my house, the hospital. My mom and I would argue, so I'd go to my dad or the hospital no matter what happened. Even if I fell off my bike, she'd always say, go to the hospital. So it was always like that, hospital and farm, because my dad always had a farm my whole life. So it's me and Giovanni here, my loyal companion, my brother, my lover, my beloved here.
And is this other photo your sister?
My sister Claudia, my dear sister. Both of them still live in Goiás. My brother is an engineer. My brother is a civil engineer at Heineken. I'm the only doctor.
And your sister?
And my sister is a dentist.
And is your wife a dentist?
And my wife is a dentist too.
And did your father come around here?
My father was recently diagnosed with a heart condition. So we came to a colleague here to have him evaluated, examined, and to get his opinion on what to do. And then he was here with me for a while, and there he is with me. He went to watch a surgery with me. It was even an honor to have my father there, because many times I watched several of his surgeries, and I never had the opportunity for him to watch mine. So on that occasion, he came to watch mine.
Does the shoemaker's children go barefoot apply? Is your father still bald?
My father is still bald because he has a very small donor area and very fine hair.
Didn't he want to use hair from his armpit?
No, he shouldn't use hair from his armpit, right?
So...
And my dad is diabetic. He's already had 3 bypass surgeries. So there are certain risks for people who already have several illnesses. So
he never considered doing it, not even when you started 20 years ago.
No, he never considered it because his donor area is too small.
I got this other photo.
Look, this guy was like a second father to me. This is Dr. Bedim. He was one of the pioneers of hair restoration in Brazil. So Professor, my teacher. So when I arrived in Sao Paulo, he invited me to work with him. So I went to work with him and he taught me a lot of things, right? So a big part of my knowledge came from him. He encouraged me a lot. So he's that kind of person who doesn't give you a fish. He teaches you how to fish. So he really taught me how to fish. Is he alive? Yes, he's alive. Someone I like a lot, right? I love him very much. He's a person I really admire.
Do you also share your knowledge?
Absolutely. For years I taught Rodrigo until I became a father, because usually teaching doctors is something you do on weekends, since doctors have their daily routines. So for years I taught classes, right? So when Lorenzo was born, I decided to cut back on that. Occasionally, I started teaching courses in my own office, and of course the people who work with me end up learning from me. I'm generous with that, as many were with me. Knowledge should be shared, not just on social media, right?
Do you also share it on social media?
Yes, I share a lot, right? I talk a lot, you know? That's the story. And I stopped teaching for a while because I wanted to have my weekends.
You are an evangelical doctor.
I am an evangelical doctor.
It's not that common for science and religion to come together, but I noticed that there's a trend today of religious doctors.
Yeah, that's the thing, right? I think before I was a doctor, I was already a Christian. So I was raised in a Catholic household until, I don't know, my teenage years. After that, I leaned more toward Protestantism than staying Catholic. So I was baptized in the Catholic Church, made my first communion. I used to live across from a church. So my little school was run by nuns. I studied at a nun school. I made my first communion, but I've always had a very strong connection with God since I was a child. So, like, whether it was in the Catholic Church or later in the Baptist Church, but I never in my whole life stopped being very close to God. So it was something, I don't know, there are things I think you just can't explain, right? What's that like?
This relationship you have with God.
It's daily, constant. It's very strong, very strong.
Can you tell me a little about how that happens inside you?
Can I drink some water? Of course. Getting emotional there, huh?
Really?
Yeah.
Why? Why?
I think that everything I am,
that I grew up
has his touch. His touch.
Can you remember when this feeling started?
since childhood, you know. I can't wake up without talking to him. I can't start a surgery without talking to him. I can't sleep without talking to him.
So he
Me.
was with me the whole time. I moved out of my house. At 15 years old, 14, 15 years old, I went to live on my own with all the support my family could give me. I never lacked anything. I've always had a good life. But he was always my companion all the time. Because sometimes you can live in a palace and still need company. Então, and he was always my companion.
And how do you feel God's presence?
I feel God's presence in the little bird that sang today when I woke up. In the light that brightened my vision today. So I am very grateful to him for everything I am and everything I have. It's not that I don't have difficulties. I deal with everyday life. Sometimes I miss my family. I handle people management since we have a lot of employees. Sometimes you feel sad with one, happy with another. Thank God I have good patience. I don't have any problems with patience. It's amazing, isn't it? You can't choose who comes to you.
But you are very welcoming.
But like the people who come to me, I don't have any annoying patients or anything like that. They're all very kind. So that's it. I think everything comes from him.
And do you bring this relationship with God into your professional practice?
Absolutely, absolutely. In my daily life, that's how it is, right? I'm imperfect like anyone else. But I carry this deep within me. I try to be as kind as possible to others. Right? Live that out. Love my neighbor as I love myself. Do good for others. If I can't do good, then I'll never do evil. right? And that's the story, right? I really try to follow his teachings. Of course, I fail, like anyone else, but I really try to follow them,
The teachings of Jesus, really.
the teachings of Jesus.
And do you realize that this comes back to you? It does.
When you do good, Rodrigo, only good comes back to you. You can be sure of that. I say it's a network of kindness, right? I say sometimes I help people. Look, if I can lend you a hand with that, connect one person to another, I do it. I joke that it's a network for good, right? So if I know the guy who sells this cup here and you want to buy a cup, talk to this guy here. He can help you. He's a good guy. He can sell you a good cup. I'm always trying to connect one person with another to help each other out, because I think that's the way, right? If you try to have good people by your side, that has a positive effect.
And do you think that today, in the world we live in, this is an exception? People with this kind of attitude? Yes.
Today people live in a very artificial world, right, Rodrigo? I even try in my daily life, outside the office, off camera, off Instagram, and just live a really simple life, right? So I know there's glamour, there's this, there's that. What simplicity is doing what pleases you, not for other people. Don't do it for them, do it for yourself. So I'm always looking for that, right? Because in this world, we're here for such a short time for you to live just to show off to others. So I have to be on social media. That's important. I have a job. There are teams that work inside my office, and there's an agency that works outside the office to showcase my work. Because you need to show your work so people get to know you more and more. So that's how it is. But sometimes people who know me more closely sometimes see that I'm a totally different person. You've already gotten to know me a little. Sometimes people see me come to the office, see me on a TV show, and they say, wow, but is it really that simple? Is that it? I say, that's it. I'm a calm, easygoing person. I'm not arrogant at all. I'm not narrow-minded at all. None of that. I'm a good person because my father taught me to be this way. He taught me to be simple, love others, and stay close to people.
Is humility a virtue?
Humility is a very important virtue to me, and I try to pass that on to my son. Because I think the greatest legacy I can leave is to leave behind a good human being. So I try to be as humble as possible, even for my family, so that I can be an example for them.
Shall we get some fresh air outside for a bit?
Let's go.
Want to get some water?
You even made me cry here.
Shall we go to the second act? Let's go. So let's go. You said you don't deserve it, but I'll still offer it. Do you want one of my fries?
I do.
Do you want it?
You like wine, right?
I like it a lot. I like everything that's handmade. And wine is one of the things I look for, especially from smaller wineries. I always avoid famous wines because they're sold a lot. I like everything that's handcrafted. Handcrafted music, anything that's more artisanal, I prefer it. Your work is all done by hand. It's one by one.
There's a near the farm, there's a U.
Push it to the side of that plate so you'll be more in the center or forward. Look.
There are some Italians who make some cheeses. I'm going to stop by there.
Am I taking it to Brazil? Yes, really? I was even going to invite you here. Look, this is for us. They're all Brazilian wines. It's a partner of ours called Queholatra, which is wonderful. They have 2 locations in São Paulo, one in Jardins, and they always send things. Something different, and all Brazilian.
Oh, that's cool.
Everything here is Brazilian. And you know a lot about products that come from the countryside. What's your relationship with country life like?
Since I was born, my father has owned a farm. So My whole life, on weekends, I went to the farm. And when I moved to Sao Paulo, I didn't have that opportunity to go to the countryside. So I stayed focused here, studying a lot and working hard in medicine,
City asphalt.
building city asphalt until the pandemic.
Did the pandemic change everything? Let's make a toast here then to our friendship.
To our friendship, may it last forever. That's it. Then the pandemic came. And with the pandemic, everything closed. So all the city life was put on hold. There were no malls. There was no theater. There was nothing.
Sparkling water or still water?
Sparkling. So since everything was closed, we were all idle, right? So I said, I'll go back. Roberta likes it.
Go back where?
To Goiás, maybe even do something out in the country.
Okay, but it wasn't Goiás.
No, never, never. Going back to Goiás was never an option because it's too far away, right? So it couldn't be in Goiás. So I started looking for something rural here in the state of São Paulo.
And what did you find? Which place?
So I went to a small town called Cássia dos Coqueiros.
Is it near Limeira?
No, it's not close to Limeira. It's near Mococa. So then I leased a farm there, started planting and raising cattle. Just like my father always did.
So today you raise cattle.
I raise cattle and farm.
Do you farm commercially or just for yourself? No.
No, quite a bit. It's substantial. So then I bought a farm there as well. So there you go. That's the place, actually. Lorenzo's there too. And Lorenzo loves it, right? So how could you not love it? How could you not love all that freedom, the animals? So both he and Roberta love it. So after the pandemic planting,
You didn't own the farm before? No.
I had it before the pandemic. It was only after the pandemic that I started going there. Then I started going, dedicating myself. Of course, I have a team that helps me, right? Honestly, I don't do much myself, you know? I produce, sell. From my own plantation, I can also take care of the cattle because the cattle eat, so you need to...
Do they eat what you plant?
What I plant, right? I make corn silage, sorghum, so the cattle eat, and
Do you supervise this or are you just the owner and have someone managing it? No.
I have someone managing it. For sure, it's not possible.
You can't do hair transplants.
And plant soybeans. Yeah, and think like now we're planting, I have a right-hand man who's my namesake, Adriano, and there's a whole team that helps me, right? There you have Mr. Gilmayo Carlinhos, who's another team that manages things, and Adriano takes care of everything. So even today, there's planting going on, so we're planting soybeans. So there are 2 tractors running, planters and everything else, right?
Don't you ever want to go over there?
Yeah, I'll go there in a little while. I'll go soon as I leave here. For sure, because I dedicate my weekends to that.
How long does it take to get there from here?
It's 3 hours from here. 3 hours, 3 hours.
And then you spend part of the week there, not just the weekend.
No, just the weekend. Just the weekend. Just the weekend. I spend the whole week here.
Because there's school.
That's right.
You haven't tried it yet. Want to try?
But let's try it then. Let's try a little piece here.
Let's go. I'll join you. There's this little toast. There's some salami.
Good. Good, good.
Did you learn how to plant soybeans or not?
I only learned recently. It's pretty recent. Because my father, he's a cattle rancher. My father isn't. He's always taking care of cattle. So I've known about cattle for many years. Now, soybeans are something I've only been familiar with for 5 years, right?
Your father, yes, he left medicine for cattle ranching.
For cattle ranching?
Is that a Goiás thing? This love for cattle ranching?
I think so. I think so. Because, like, when I lived in Goiás, all of my dad's partners at the hospital had a farm. Because sometimes when you start working in a small town, you don't have much to do on the weekends. So what are you going to do? Go to the farm.
But then it's not just for fun. Does your dad work the farm professionally?
No, my dad has had a farm his whole life. And like, it's not just a weekend thing, a little piece of land just to go plant a jabuticaba tree and eat. It's not like that. We have crops on an industrial scale, cattle, a lot of cattle. So that's not just enough for you to feed yourself. And that's what I'm always looking for in everything I do. Is this going to bring any benefit to people? If I have cattle, what will these cattle provide? Will they give meat? Will they give milk to someone? Because people don't know how hard it is to put this cheese here on our table. This meat on our table, the food on our table. If there weren't people involved in this, Rodrigo, we wouldn't have a way to feed ourselves. And one thing, you can go without an iPhone, but without food you can't. So, that's not very valued in a country like ours where everyone has plenty of food. Sometimes I operate on patients. I mention surgery because I get to know a lot of people in my office from Japan. Food is expensive and hard to get.
Do you have Japanese patients? I do.
I do. Brazilians who move there and come here for treatment. They come to me for a transplant. Então, so they value food because eating is expensive there. Not everything is available. The United States is already better. When you travel to the United States, I go there often. Even Lorenzo, there comes a time when he wants to eat a meal at home.
Why?
Because he gets a little tired of restaurant food. So he wants to eat fruit all the time because there's a lot of fruit here.
Do you think we're privileged?
Very privileged. Our country is very privileged and we should value that.
Why do you think we don't value that?
Because you see, farmers are seen as people who exploit the land, a deforester. That mindset has to end. When we think about deforestation in the Amazon, for example, it's 20%. If someone owns a farm, they can only clear 20% and they have to take care of the other 80%.
But does he respect that?
Some respect it, some don't. Those who don't respect it should be punished. Do you agree? Here in the Cerrado, right? The Cerrado also has an area that needs what? To be preserved, to be cared for. So each biome has its own specific area. So the farmer who produces beef, who produces soy, who produces these things, he's not a destroyer of nature.
The problem is those who deny it.
Of nature.
There are some who deny it.
Yes, and those people should be punished for sure.
They deny the need to care. They deny what they're doing. That's a fact. We can't argue about that. But of course not. It seems to me most of them aren't.
No, even those situations like that do exist.
But is there an awareness among farmers that it's necessary to protect the planet?
The more aware ones, for sure. For example, I think about it all the time. Because where are we going to live? Where are our children going to live? If we don't take care of it, there won't be a way to live. I'm not going to say when, but if we don't handle it, it could happen soon.
Yes. Your relationship with the countryside comes from your family, but it has changed. It's grown now.
Yes, because now I take care of it, right? Now it's not my father who takes care of it. Now I'm the one who takes care of it.
Did that change you in any way? Did it make you see life differently?
It's lighter, it's nicer, right? Nature gives you a good outlook.
Don't you ever think, I'm going to stay here for good? I don't want to go back to the big city anymore.
No, because I love what I do, right? So I want to keep sharing this for sure, Sometimes when I travel, I also look for places in nature. But I'm there in Florida. It's nice to go through the interior of Florida. There are farms, orange plantations. Florida isn't just about water.
There are wonderful water springs.
Beautiful water, right? So Florida isn't just Miami, Fort Lauderdale, and others, right? There's a lot of nice things there. For example, once I watched a report about New York's water. Around New York, there are several farms that help protect the water supply. So that cows don't walk in the water, so that tractors don't go through the water, so the water can flow from its source all the way to New York without contamination. So that's really cool, this concern for nature, right?
And what about your religious side? How do you maintain it? Do you attend? Do you go to services? What do you do?
I do. I go to services frequently. So it's something I practice, not just talk about, right? So today I attend the Assembly of God
In São Paulo?
in Engenheiro Coelho, which is where I go more often. It's next to Limeira. My wife stays there during the week. So I spend the week here and go there on Thursdays or Fridays. So I go there on Thursday or Friday and stay until Sunday. And on Monday morning,
Do you have 3 addresses?
3 addresses.
That's a lot of driving, a lot of time on the road.
That's a lot of time on the road.
But do you like being on the road?
I do. The road is like a companion because on the road you can't reflect too much. You can listen to a message, you can listen to a song and reflect. The road, I think it's a good companion for reflection.
Is there any passage from the Gospels that you especially like that touches you in a different way?
No. In a verse from Proverbs 16, it says that a man's heart makes plans, but the right answer comes from the lips of the Lord. So I think this really inspires me because sometimes we make so many plans and sometimes the surprise is that something better comes along than what we had planned. I don't know if this has ever happened to you. It has. So when I look into your eyes, it seems like you're going through such a joyful phase, right? So sometimes you planned a lot of things in your life. And sometimes things came along that made you go much further, made you much happier than you had planned. I talked to Anna a few days ago, and then Anna told me about how you two met. Then she told me it was at the airport. So, I mean, I'm sure you didn't plan to meet your soulmate at an airport, no. Being around many people, you've worked in all kinds of settings, from content creation to beauty and everything else. And sometimes God promised you something special, more beautiful, more fulfilling to bring this joy into your life. So these are the stories that I sometimes think about. For some, this is a coincidence. This is destiny. Not for me. I think God's hand is in this.
And here is God's hand in this. Music is divine.
That's right. As soon as I finish my master's degree, I've always liked music. So when I finished my master's degree, even an advisor asked me, "Don't you want to do a PhD?" I said, "I don't think so." Because Lorenzo was on the way.
Here you look like a country music artist.
But I pursued that, Rodrigo. I always try to do well whatever I'm doing. So I've always liked country music. I'm from Goiás. So I said, I'm going to record a song.
What was the song you recorded?
So I didn't know what the song was. I even started composing. I wrote a song called E Pau, which is a song,
Is Po a reference to Tom Jobim's song? No.
it has nothing to do with it, actually. Actually, E Pau means it's tough, it's hard. So the Brazilian song, that life is easy, it's work, it's this, it's that. And in the end, what do we want? To have a beer, relax, and that's it. So when I composed this song, I thought about recording it. And then the other songs came. Then came the opportunity to record another one, and that's how it went.
But was that already in a professional setting or not?
In a professional setting. When I decided to record, I immediately sought out a professional. For example, the one who recorded my first 2 songs was Dudu Borges, who worked with Gustavo Lima, Bruno, and Marrone. So I already tried to record everything in a professional way. I never did anything as an amateur.
But how did you develop your vocal skills? How did you become a singer?
I studied.
You studied? I did. Was it before or after med school?
After,
Is it recent?
During the pandemic, exactly.
Back in the countryside?
Here, I took classes with Gava, who's a well-known guy. Singing lessons, singing lessons. He trained the girls from Faustão. I always ran into them there. He also trains Aguinaldo Rayol and others. He's always like,
How do you find all this time? There are 12 hours of surgery.
so
This story is to take care of.
if you want to, you make it happen. So that's how I am. You know how it is? Every minute of my life is timed so everything works out.
But are there moments of leisure?
That's right. My moments of leisure are on the weekends. Why? For example, singing lessons. I used to take them at night. Today I don't do it anymore because after I recorded the songs and everything, then the pandemic started. I did a few shows, you know? And then with the pandemic and the farm and everything, I stopped with music for a while because it really started to get difficult. The clinic too. Surgeries increased a lot. So I cut back on that, you know?
You looked over there. You already know why. You saw someone coming, right?
So the music got put aside a little, right? I did what I wanted. Recorded a song, released an album. I released it. I released the album. It's on YouTube.
Did you perform live?
I performed live.
And I missed that.
You missed it.
No, I won't accept losing that. So you know I won't accept it.
Yeah. So that's the story, right? And then I stopped with music for a while and dedicated myself to the farm. And today, my weekends and music really ties you down. Now you said such a demanding schedule because, you know, you have to do it well. So vocal lessons. You need to have a band so you're always ready to perform. I also performed on some television shows.
Did you already have that talent already?
Look, I always liked it a lot, but I never really pursued it. When I was little, I used to sing a bit, took guitar lessons, then later I studied. And when you start studying for the career I decided to dedicate myself to, which is being a doctor, your life becomes very limited. So you end up not having much time for things. So I only devoted more time to music when I finished my master's degree. Then I said, now I'm going to do this because I was more relaxed. So I focused on that. I recorded some songs. And then I realized that musicians also have a pretty hectic life because of the schedules.
Did you consider that career? No.
I never planned to leave medicine for music. That wasn't my goal. I just learned.
I didn't want a second career either.
That was never my goal. No, it's like this, Rodrigo. Music in Brazil. People think being a musician is all glamour. It's not. It's tough. A musician isn't someone who gets paid a lot, at least not for those who aren't well known. Of course, when you look at big artists, they get good pay.
Not everyone becomes Gustavo Lima.
Not everyone becomes Gustavo Lima. So it's difficult. So since I'm already successful in medicine, it was never my goal to leave medicine and start from scratch in music. So could I pursue something on the side? I could. And I did that on the side for a while. But it takes up a lot of your time, a lot of your dedication. Either you do it well, I always think about that, or you don't do it at all.
You don't do anything half-heartedly, right?
I try not to do anything half-heartedly, I'm sure of that. So since I no longer had as much time to dedicate to music as I'd like, so I cut back, right? I do. When there's something going on at home, I chat, laugh, sing a little, and that's how it is.
You're not leaving me hanging today, right?
If I can help it, I won't leave you. A friend's a friend, right?
Let's move on to the third act and make it unlike anything we've done before.
Yeah,
Third act with music, shall we? Oh,
let's go.
can we bring the wine, Pereira?
Let's bring the cheese and let's go.
Make a country music jam. Look,
Now that's it, let's go.
so let's go.
But I'm going to suggest that today you take off your doctor's coat and put on your singer's outfit. So let's go.
Right?
Let's go. And I'll put mine on too because I'll accompany you. Good.
Now that's what I'm talking about, huh?
Let's go. Now,
I never
saw a singer.
without a musician.
Come here, Guilherme. Because without a musician, it doesn't work, right?
Look, there he is. So, you have a song you wrote that became popular on the internet.
It became popular on the internet. It's called Microphone Here.
Look.
It's tough.
It's tough. It's tough.
Like a song by Tom Lopim.
It's hard. It's tough. Yeah, shall we listen?
Let's go.
My friend, life isn't easy. It's work, it's steel, it's tough. It's the boss traffic.
Confusão.
It's tough, it's tough, it's tough.
The dollar that skyrockets, the stock market that never stops. Its reports, its deadlines, everything goes
Pro espaço.
tough.
It's tough, it's tough,
It is
tough.
Buddy, life isn't easy. It's work, it's tough, it's hard, man. Traffic.
Fusão.
It's tough, it's tough, it's tough.
it's tough.
The dollar that skyrockets, the stock market that never stops. Its reports, its deadlines. Everything goes out the window. It's tough, it's tough, it's tough, it's tough.
É pau, é pau, é pau.
That's it, folks. Keep your cool because you only live once. If you don't. It goes wrong, it goes wrong. And this song was a hit. This song was a hit. You released it during the pandemic. I released it during the pandemic. It was the first song I recorded. It was my own composition. And it was produced by Dudu Borges as well. And it was a success. More than 1 million views on YouTube. And I recorded the first song. And then there's always that nice feeling, right? Because you start meeting people. The atmosphere becomes pleasant for those who enjoy it, right? And then came a second song, which is Let Me Drink in Peace. I always had control of the situation. No one bossed me around. Only I said no or yes. Only I said yes or no. You showed up and made me fall hopelessly in love. Little by little, I started doing whatever you wanted. You want to know? I don't care what people are going to say if she's tired. I clean the floor, wash all the clothes by hand, and cook. Every day. I take her to the boutique, to the salon. I'm always available. I treat her family well, but I just ask for one big favor. Let me drink in peace. Let me drink in peace. Let me drink in peace. Let me drink.
Deixa eu beber em paz.
Let me drink in peace. 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 I always had control of the situation. No one bossed me around. Only I said no or yes. Only I said yes or no. You showed up and made me fall hopelessly in love. Little by little, I became someone who just does what he's told. If you want to know, I don't care what people are going to say if she's tired. I clean the floor, wash the clothes all by hand, and cook every day. Take her to the boutique and the salon. I'm always available. I treat her family well, but I just ask for one big favor. Let me drink, let me drink, let me be, let me drink in peace. Let me drink in peace.
Deixa eu beber.
Let me drink in peace, let me drink in peace, let me drink in peace. That's it, Dr. Adriano Almeida. And that's how we say goodbye. What a joy, what a joy. It's a pleasure to be here with you. Here's to this new hair and to much happiness. Thank you for the invitation. It's so good to have you here. We started out with me as a patient, kind of wanting to understand who this doctor is. Should I? Shouldn't I? I stopped going for a few months, then came back and we became friends. It's so good to have you here. Thank you. Thank you. Thank you, Guilherme, as well. Thank you, Guilherme. Thank you, Guilherme. Thank you, Guilherme. Thank you, Guilherme. It was great. And I learned how to sing today. You're good at backing vocals. Did you like it? I did. Bye-bye. God bless you. Take care. I'll walk you to the door. Stay.